Hello everyone, my name is Tom and I'd like to welcome you to ADO's May webinar with Peripheral Neuropathy Awareness Week coming up. We put together this in-depth presentation on the subject entitled, What is Peripheral Neuropathy? Today's speaker is Clinical Assistant Professor from Georgetown University and ADO's Medical Director, Dr. Howard Zahalsky. Welcome, Dr. Zahalsky, and thank you for joining us today.
Thank you very much, Tom. So today we're going to be talking about neuropathy, particularly peripheral neuropathy. And in front of you now, you're looking at a typical picture of a nerve cell. Nerve cells have a main part, which is kind of on the left of the screen, which includes the brain of the cell, the nucleus. And then they usually have a long stalk called the axon that you can see running across the screen. And then they have little tendrils at the bottom where they connect to other cells or muscles. What is neuropathy? Well, neuropathy is any problem of a nerve cell. It is a very nonspecific term used to refer to anything that injures the cell anywhere along its course, from the big central part down the axon to the little tendrils at the bottom. When we talk about neuropathy, the type of neuropathy we usually talk about is peripheral neuropathy. Peripheral neuropathy means having to do with nerves that are not in your brain or your spinal cord. Those are parts of what we call the central nervous system. But the nerves that are outside of that, the nerves that go to your skin, that go down your arms, and particularly down your legs. So what are some of the things that can actually cause peripheral neuropathy? Well, injury to the nerves certainly can, physical injury. Inflammation of the nerves from a variety of reasons, including medications and drugs. Infection, you can actually get infections of nerve cells. And finally, ischemia. Nerves need blood too, and usually you've heard the term ischemia maybe in past webinars, used to refer to parts of your body, your brain, or often your heart, not getting enough oxygen. Well, nerve cells need oxygen as well. And many nerve cells have their own blood supply. And if this blood supply is interrupted, the nerve cells suffer, they get ischemic, and the nerve cell stops working like it's supposed to. So let's see how nerves might suffer from peripheral neuropathy. And we're going to go on to the next slide. So the feet. Why am I starting with the feet? Well, the longest nerves in the body, and therefore the nerves that are actually the most susceptible to injury, damage, ischemia, are the nerves in the arms and particularly the legs. Most cells in your body are tiny. For instance, in a drop of blood, in a single drop of blood, there are up to 500 million blood cells, 500 million in one drop. On the other hand, the longest nerve cell in your body goes all the way from the tip of your toes, all the way to your spinal cord in the lower back. That can be over 3 feet long, and it's one cell, most of it made up of, remember those axons that we were just looking at, that long connection between the brain of the cell and the little tendrils at the end. One of those axons can be over 3 feet long. Because they are so long, they are certainly susceptible to any kind of injury, inflammation, infection that we were just talking about. And since, again, the longest ones are in the feet, if you're going to get peripheral neuropathy symptoms, it usually starts in the feet. So what are those symptoms? Well, there's the more passive type of neuropathy, the one where you just kind of lose feeling. Your feet may get numb. You may lose your ability to know where your feet are in space. How would you do that? Well, you take a step and you're not quite sure where you've put your foot down. We call that proprioception. On the other hand, there are more active, irritative types of peripheral neuropathy. These are the ones where instead of just feeling numb in your feet, you actually get too much nerve sensation. That can lead to the pins and needles sensation or a chronic unpleasant burning sensation in your feet. And both of those are kind of the two sides of the same coin of peripheral neuropathy. So what are the causes of some of these peripheral neuropathies that obviously we would like to avoid if we can? And the main cause of peripheral neuropathy, the most common cause in the United States, is seen on the next slide. So here's someone checking their finger stick blood sugar because they have diabetes. Diabetes is, again, the most common cause in the United States of peripheral neuropathy. Now, fortunately, just because you have diabetes doesn't mean you're going to get peripheral neuropathy. In fact, usually you have to have diabetes and it has to be poorly controlled for over 15 years before you actually develop the peripheral neuropathy. The neuropathy tends to start in the toes and move its way up. It oftentimes is that unpleasant burning type of neuropathy and will start at your toes and it will eventually climb as high as your mid-shin. You may be surprised to learn that the peripheral neuropathy associated with diabetes is not because of high sugar affecting the nerves. Well, that's the point of diabetes, isn't it? That the high sugar does all of this damage? Well, on the next slide, we will see how diabetes can actually cause peripheral neuropathy. So the main way that diabetes does most of its damage, whether it be to nerves, your eyes, your heart, your kidneys, is by clogging blood vessels. If you've listened to our diabetes webinar, you know that when you have too much sugar floating around in your blood, those sugar crystals floating in your blood essentially scratch up the walls of the blood vessel. In an attempt to heal these scratches, your body puts bandages that we call plaque along the walls of the blood vessel, and those can cause the blood vessels to get narrower and narrower. Now, remember when I started, I talked about ischemia, that all parts of your body, including your nerve cells, need blood. And because some of these blood cells are so big, so long, they need blood all down the length of the whole blood cell. Now, let me describe nerve cells in a little bit more detail so you can get a picture of just how hard it is to supply nerves with blood and just how thin these blood cells are. One neuron, one of those axons, one of those long lines running 3 feet down your leg, can be as little as a millionth of a meter wide, 1/1,000,000th of 1 meter. As a basis of comparison, a human hair is about 200 times as large. So it is so thin that it is 1/200th of the width of a human hair. Now, these axons are oftentimes bundled because you have a different nerve going to the tip of your toe, and then a different nerve going to the top of your toe, and then a different nerve going to the inside and outside of your toe, and that's for each toe. So your body bundles all of these nerves into a bundle, and when it goes down your leg, we refer to that in the term that many of you have probably heard of as the sciatic nerve. So when you look at the sciatic nerve, it's going to look, if you were to do surgery, as a lot bigger than the width of a human hair, but that's because there's thousands or even tens of thousands of nerves running together. Those nerves need their own blood circulation. And so the body has come up with this ingenious plan where it creates blood vessels just for the purposes of supplying the nerves down their whole length with blood. And those special blood vessels that do nothing but give blood to the axons of these nerves are called vasa nervosum. No, there won't be a test at the end. These vasa nervosum are about 60 times as wide as the axon, the body part of one nerve cell. But that still makes them about 1/3 the width of a human hair across. Because these blood vessels are so thin, it is easy for them with even a little bit of sugar damage to slowly get clogged off. And because these blood vessels run so long down the whole length of these 3+ foot nerves, if they get clogged anywhere along that course, the nerves are going to start to suffer. And when the nerves don't get enough blood, they don't work as well. They get irritated, they start burning, they cause numbness, which is how diabetes causes most of its nerve damage by clogging of these tiny little blood vessels running alongside the nerves. But diabetes is far from the only cause of neuropathy, peripheral neuropathy, in the human body. And one of the other chief causes of neuropathy that we see in medicine in the United States is on the next slide. Alcohol. Excessive alcohol consumption, you're probably aware of, can cause a lot of nerve damage. You can think of chronic alcoholics who have foggy brains, even in those few times when they're sober. Well, it is not only the nerves of the central nervous system, the brain, that can be affected by alcohol. The peripheral nerves are just as susceptible, if not even more. So some people who are chronic alcoholics can get numbness, tingling, and burning in their hands and their feet, just like a diabetic. Now, remember, we talked briefly earlier about that proprioception, the ability to tell where your foot might be in space. As a test, I want you to all try something. I want you to close your eyes and touch your nose. Actually, not that hard to do, is it? Why? Because even with your eyes closed, you know where the tip of your finger is, and you know where your nose is. And your body is able to put those two things in the same spot. That's one of the things that alcoholics can lose, is the nerves that carry the sensation for proprioception, which is why if a drunk tries to touch their nose, they oftentimes hit themselves in the eye or the chin. And if they try and take a step, they don't necessarily know where their foot is relative to the ground, even if they're looking at the ground. This can lead to tremendous balance issues, which is why people are said to be falling down drunk. All of this is caused by alcohol's direct toxicity to the nerves. It just makes the nerves work less well. Now, some other more treatable types of neuropathy can be seen on the next slide. So here you have a doctor drawing up a red liquid into a syringe to inject it into the patient. What horrendous red liquid would a doctor be injecting into a person? And the answer is, this is vitamin B12. There are some people who lack a certain chemical in their stomach that allows them to absorb vitamin B12. Now, vitamin B12 is a very trendy vitamin for people who are just feeling tired or weak, to give themselves shots of to make them feel stronger. To be honest, that probably doesn't do any good whatsoever. But people who lack this chemical called intrinsic factor in their stomach can become vitamin B12 deficient, no matter how much vitamin B12 they take as pills or in their diet. And they may have very little in the way of symptoms until their longer nerves and their peripheral nerves start to suffer because of it. Again, they will get tingling in their hands and in their feet as one of the first symptoms, and can actually have memory problems as well. That's why whenever someone comes in to a doctor's office for peripheral neuropathy, one of the things that doctors usually do is check a vitamin B12 level. The good news about vitamin B12 deficiency is that it is one of the few reversible causes of neuropathy. Once you've damaged nerves enough with alcohol, and once nerves have become ischemic due to poor circulation, due to long-standing diabetes, those nerve problems are oftentimes irreversible. But vitamin B12 deficiency can be reversible. And you do that with initially weekly followed by monthly shots of B12. Again, because your stomach will still not make the necessary protein to absorb the B12, you can't fix B12 deficiency in most cases by giving pills, and it needs to be supplemented with shots. Now, there are some times, even though the nerves of your body that are the longest are in your legs, that you can get neuropathy that affects your hands more than your legs. And we'll see that on the next slide. So here's someone rubbing their hands. And it's one of the main reasons that people get numb, tingly, even burning pain in their hands because of neuropathy is carpal tunnel syndrome. I'm sure many of you have heard of carpal tunnel syndrome. It's a neuropathy that is caused by injury as opposed to ischemia or toxicity. In carpal tunnel syndrome, problems with your wrist, oftentimes due to repetitive motion injuries, and for instance, a typist, will cause pinching and damage to the nerves that go from your hands up through your wrists, through the arms, back to the spinal cord in your upper back. If you have carpal tunnel syndrome, you oftentimes notice the symptoms most at night. Why? Because when you're sleeping, your wrists naturally bend inward, which pulls a little bit more on those nerves. So people with carpal tunnel syndrome oftentimes wake up with tingly, painful hands. What's a sure sign that you have carpal tunnel syndrome and not a different type of neuropathy affecting your hands? In carpal tunnel syndrome, the nerve that goes to your fingers only goes to your thumb and the next three fingers. The pinkies have their own nerve supply. So when you wake up with those cold, tingly, painful fingers and you're wondering why, ask yourself, is the pinky affected? And most of the time you'll say yes, until you actually go and you rub it. You say, no, it turns out I still have good feeling in my pinkies. That's a good sign you have carpal tunnel syndrome. How do we deal with carpal tunnel syndrome? Well, trying to avoid the repetitive motion injury can be helpful. Sometimes wrist splints that you wear either while you're typing or while you're sleeping can be useful. And in the most severe cases, you might actually need surgery to unpinch the nerve. So what are some of the complications of chronic peripheral neuropathy? Well, particularly for the ones that affect the feet more than the hands, over time, in addition to the uncomfortable, unpleasant burning that you might get in your feet, you also lose feeling. Remember, your feet feel numb. Some of you might be saying right now, oh, that's great. I have chronically achy feet. I wish I could not feel my feet sometimes. Except that feeling in your feet serves a very powerful purpose. It is to keep you from injuring your feet. When you're walking around, if one part of your foot starts to feel a little sore, you get a little blister, you shift your weight ever so slightly to protect that part of your foot. Even if you don't have a true blister, your body is always shifting weight, a little here, a little there, to protect the skin. People who can't feel their weight, don't feel their feet, don't do that, and develop pressure sores on the bottom of their feet that can be very difficult to treat, because the only way to treat them is to stay off that part of your feet, and you can't feel it, so you don't know when you're resting on that part of your foot. The result can be pressure ulcers that are very hard to heal up. So how are we going to prevent these complications and even peripheral neuropathy in the first place? The best way is to see your doctor on a regular basis. When you see your doctor will be checking for those routine things such as diabetes, high blood pressure. They'll be asking you valuable questions about alcohol consumption in most cases. And if you're starting to get just a little bit of peripheral neuropathy, you're starting to have some tingling in your feet, but you just thought it would go away because these things generally just go away and it's not too painful yet, your doctor will catch it early and maybe be able to make adjustments or do tests that will prevent the peripheral neuropathy from becoming worse and more problematic and more complicated. So what am I trying to represent here with someone getting beat up by someone in riot gear? Nerves are very unforgiving. When you injure a nerve, it does not get better quickly. So whether it's alcoholism or diabetes, that once you injure the nerve, there's almost no coming back from it. Or vitamin deficiency or carpal tunnel syndrome, which are reversible causes. Even then, nerves take weeks, months, or even years to heal. It can be very difficult to heal a damaged nerve once it's already been damaged. For instance, once you have a stroke and one side of your body is weak, oftentimes you never recover. And once you have damaged a peripheral nerve, just like a nerve in your brain, it can be very difficult. It can take long periods of time, if ever, for those nerves to recover. So it is very, very important that we catch peripheral neuropathy early, that you see your doctor, you get tested, and we treat you in the best way possible for your peripheral neuropathy. Because once the damage is done, those unforgiving nerves may not come back and you may not get back to where you wanted to. So don't ignore the signs of peripheral neuropathy. So how can Activ Doctors Online help you with peripheral neuropathy or the issues that may lead to peripheral neuropathy? Activ Doctors Online has 3 very effective ways to help you maintain your health and to prevent problems such as peripheral neuropathy. First, we have our personal health records, where information from all of your doctors can be stored in one central, secure place online. This prevents things such as hints of vitamin deficiency from being lost because one doctor has it and the other doctor isn't able to see it. It allows you to, with our intelligent health tracker, track such things as your blood sugar if you're a diabetic to make sure that you maintain optimal blood sugar control, which can prevent peripheral neuropathy or other complications of diabetes from happening. Next, we have our online second medical opinions. Activ Doctors Online has thousands of top specialists from around the country and around the world. So if you are suffering from a complicated medical problem, including a more complicated type of peripheral neuropathy, you can, through your PHR membership, get one of our second opinions so that we might be able to help you get the right treatment the fastest possible so that you can get treatment, get help, and maybe prevent the damage to the nerves that we've already established can be irreparable once it's already happened. And finally, with our e-consultation feature, if you and your doctor are both members of Activ Doctors Online, you will be able to potentially contact your doctor online should a question come up, such as, my hands or feet are starting to feel numb. Is this something that I need to come in for? And your doctor will be able to tell you how urgent it is to get you in quicker without actually having to first schedule the appointment and wait possibly weeks to get in to see the doctor. With that, I'm going to pass it back over to Tom, who will tell you how to potentially get involved with Activ Doctors Online and start a free trial for your membership in Activ Doctors Online.
Well, thank you, Dr. Zahalsky, for another great presentation. Here at Activ Doctors Online, our vision is to reinvent healthcare by providing user-friendly, mobile health solutions that allow people all over the world to live healthier, safer, and more productive lives. We strive to educate, engage, and empower our members to take control of their health destiny, to save time, money, and even their lives. We hope you've enjoyed today's presentation, and we invite you to start your free 30-day trial over at activdoctorsonline.com. and by clicking Get Started. For more information, to schedule a demo, or if you have any other questions about our service, please feel free to contact Activ Doctors Online using the information on screen. Thank you very much for watching, and we look forward to seeing you next month for another informative health webinar.